Hello, I'm Dr. Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is nasal surgery, or what's called rhinoplasty. Rhinoplasty is actually the oldest plastic surgery procedure performed, but a lot has happened and we've come a long way. What are the indications or what are the reasons for doing rhinoplasty? There's two. One is cosmetic, one is reconstructive, and we often couple them together. Cosmetic: nasal hump, nose too big, ill-defined tip, droopy tip. Cosmetic: inability to breathe well, caused by a crooked septum or large turbinates. That's called a septoplasty. So, what is a rhinoplasty and how is it performed? There are two types of incisions. One is what we call open, the most common, and that's performed through a small little incision here at the area of the nose called the columella. The only people that see that incisions are your lovers and dogs. The other incisions are all internally. When we perform the rhinoplasty, we do this while you're asleep. I feel it's just too painful to do it while you're awake, and I want you to be absolutely still because this is the most precise surgery we do. We then elevate the skin off the nasal skeleton and cartilage very gently. We then trim the extra hump to the right proportions. If the tip is too wide, we narrow that tip. If it's droopy, we elevate it. If the base is too wide, we reduce it with what's called Weir wedges. The septoplasty. Think of this as a partition or a wall between two rooms. The septum is like the 2x4s or steel 2x4s. The drywall is the mucosa. So what happens is we remove the septum but leave the framework so the nose has support. We then sew the two drywalls or the mucosa, the lining of the nose, together to straighten the nose. This way the nose goes from a crooked septum, difficult for air to go in, to a straight septum. You have a series of 6 air conditioners or humidifiers, superior, mid, and inferior turbinates. If they're too large, we'll reduce them or excise them. What's the recovery like? Well, when you wake up, you'll have some bruising despite giving bruising and anti-swelling medicine. You'll have a splint on the nose. If we do the septoplasty, you'll have an internal splint. It has little holes in it, so it allows you to breathe through. You'll have a little incision here. You'll have what we call a little mustache dressing. That just collects the ooze and is changed for the first 1 or 2 days. You can shower the next day. I don't recommend exercise until the splints are off. The internal splint comes off in 7 days and the external splint in 10 days. When we remove the external splint, voila, you'll see a great result. However, it gets better. It takes up to almost 9 months or a year for the swelling of the skin and the shrinkage of the skin to go away. Now, the major swelling's gone in 4 to 6 weeks, but it shrinks and shrinks and shrinks. Okay, we've talked about the procedures. I like patients to bring me pictures of their idealized nose. Can I make somebody else's nose? No, but I can get the general feeling and look you want. When can you go back to exercise? After about 2 to 3 weeks, I let patients go on an elliptical trainer or stationary bicycle. If the nose swells or increasing pain, you stop. You can do higher impact exercises after 6 weeks. In summary, rhinoplasty or nasal surgery is done for 2 reasons: cosmetic, better appearance; reconstructive, so you can breathe, often coupled together. The operation is straightforward, it's delicate, but it's very rewarding. I thank you very much.